Good afternoon, everyone. We are going to get started in just a moment, so feel free to let us know where you're dialing in from in the chat, and then feel free to post your questions in the Q&A box. All right. Well, hello everyone again. My name is Maya Nixick and I am BIG's program manager. I am delighted here to be joined with Professor Michela Carlana. Michela Carlana is an assistant professor of public policy at the Harvard Kennedy School. She's affiliated with the Malcolm Wiener Center for Social Policy and the Women in Public Policy program. She's working on topics related to inequality and education with a focus on gender and immigration. She's also faculty affiliate of JPAL, Lead Bocconi, and research affiliate of ISA. Welcome, Michela. We're delighted to have you here.
Thank you so much for this invitation. Okay, so the paper I will present today is a joint work with Iana La Ferrara at Bocconi University, and it was our attempt to try to mitigate the impact of COVID-19 on education inequality before this actually emerged, so in the middle of the COVID-19 crisis. The paper is based on data and a project that was implemented in the Italian context. So as you all know, in response of the COVID-19 outbreak, schools have been closed in more than 130 countries. And this was mainly done to reduce contact among people and trying to save lives. Clearly, this has a strong implication for the education of students, and in particular, this will have strong impact on their parents' productivity because they had to homeschool in a lot of countries, but it has a strong implication for the children's well-being, their learning, and their socialization. Several academics and policymakers around the world have been very concerned about the impact of the increase in homeschooling on inequality in schools and among students from different socioeconomic backgrounds. And there is, like, from past evidence, we may share that this has a strong implication for the increase in inequality that we may have, and with children from disadvantaged background lagging behind the most. So these are a few of the headlines we had in the middle of the crisis from different countries that was showing a little bit all the worries that were there from policymakers and academics in terms of the impact in inequalities in schools. However, we were often not ready to implement new measures in the middle of the crisis that could help mitigating these potential loss that would mainly be detrimental for disadvantaged children. Recently, we started to see some data on the impact that this learning loss may have on inequality. And this is actually coming from some other colleagues here at Harvard and some co-authors of the opportunity inside the team, that they show what happens using Ziern, and this is like an online platform that was used to substantially study math for children in US schools. And here I show you like graphs from the Opportunity Insight website, where they are divided by 3 different income groups in terms of the zip code of where the students live. And we have the high income students, and here we have substantially the period of the lockdown, when the lockdown started and when the schools started to close. And what we can see is that substantially this line in terms of progress done by students in their math learning has been pretty flat for high income students, but there is this huge drop that we see here between high income and middle and low student living in middle and low income areas. And these are all data from schools that were actually using already this platform before the school closure. So this is very important to keep in mind, because it's already starting to show some evidence of learning loss and inequality across different areas with data that we can measure at this point in time. So the purpose of this work is actually to study how we can mitigate the impact of school closure on educational inequality. We implement a large-scale intervention that is feasible and potentially also scalable in the future. Indeed, I will tell you toward the end of this talk that we are actually planning to scale it up, and we will start in a couple of weeks the second round of this intervention. The intervention was pretty straightforward. And it was mainly done to fit 2 criteria. So the first one was that it needed to be feasible in the very few days from when we thought about the intervention, in order to avoid a further increase in inequality between the different income groups. And the second, it needed to potentially give us some useful insight that could provide some broader implication for the future and how we address school inequalities in schools in the future months and years following this crisis. So the intervention was also very low cost and did not require in-person interaction. So what we did was simply to match students from disadvantaged background, and I will tell you more details about how we selected the children, with tutors that were volunteer university students. The tutoring was fully done online, and it was mainly based on volunteer work. However, there was some pedagogical expert support that we were providing in order to make sure that the students and tutor had the right support also in cases that could be more difficult to handle, especially given that a lot of these children were facing really disadvantaged background, and potentially during the lockdown, the consequences may have implication also for their parents and the interaction of what the tutors could see during the online tutoring in the home of the children. The children that we matched were middle school children. So substantially, they were children in grade 6 to 8. And the target was mainly done in terms of disadvantaged children in socioeconomic background. Some of them had language barrier. We had a pretty substantial share of immigrant children. And some of them had the form of learning difficulties or learning disabilities. We evaluate the causal impact of this program and that we designed and implemented using a randomized controlled trial. So we had way more students and families that applied for this project compared to the number of tutors we could support during this emergency. So we set up a support system for around 500 tutors, but we were way oversubscribed in terms of a number of students that actually needed the support. We collect outcomes using, for now, survey data to students, parents, and their teachers, both in the treatment and control group, including like a wide variety of outcomes from academic performance to beliefs of students and parents and teachers on the ability of the child, but also aspirations, social emotional skills, and well-being, including like a depression scale. For children, that could be particularly important, especially in the middle of the COVID-19 crisis, where children were not socializing in school as they were used to. Okay, so this work actually contributes to different strengths of literature in behavioral science and education, and the economics of education. So the first contribution is actually in providing evidence on the impact of an online education intervention that is mainly addressed to decrease inequalities in student outcomes. So we have evidence from past interventions, for example, trying to give like devices and computers to students. And often these were like not very effective, because you need also an appropriate support in order to be able to actually use the devices that you are offered. And so you will need to somehow a sort of like a technology mediator that helps to take fully advantage of this intervention. And this is also a role that our tutors implicitly had into this intervention. So our contribution here is to develop and implement this cost-effective education intervention that was mainly targeted to children from a disadvantaged background. So we know also that one-to-one in-person tutoring is very effective, is one of like the most effective intervention you can have in terms of like education in the education world. But on the other hand, we don't know whether there is like a limited evidence of whether this online intervention could actually have positive impact on student learning and their social emotional skills. And this is where we provide like a causal evidence of. And finally, we don't limit ourselves to academic outcomes, but also we show evidence on like a wide arrows of non-cognitive aspects, including like aspiration, social emotional skills, and the depression measures. So the setting, as I said, this paper is set in Italy, and let me give you a couple of information about the background and what happened in terms of like timeline in the Italian context. So on the 5th of March, all schools closed, shut down. At the beginning, we were expecting this to be like a temporary measure for like a few weeks. But actually it was repeatedly extended until the end of the school year, and schools actually reopened only in September. Few days ago, we had like all schools that were back to normal activities. So this has been like a very prolonged lockdown, and like we've limited the social interaction for these students. So around March 23rd, we thought about this program, and we thought that we needed to do something in order to mitigate the potential negative impact that could arise from this lockdown, especially for disadvantaged students. And in few days, actually a few weeks, we were able to implement this intervention and recruit all tutors, schools, and children, and the treatment started around April 10th and went on until the end of the school year, even if like I know that some tutors have been in touch for the entire summer with their tutee, with the students they were assigned to, in order to help them and support them also during like during the summer holidays to catch up with work they haven't done during the school year. We collected end-line data for this study starting from June onwards. So the data collection finished around like July 5th. So we had 1 month in which we collected the survey data by sending like surveys to teachers, parents, and students, including several information, including also some measures that were collected directly by an enumerator with like a phone interviews and like a sort of like a achievement test score that was done with the presence of the enumerator, but like by the student him or herself with the enumerator that was not allowed to see actually the screen of the student. It was just a way to make sure that the students were actually doing the end-line standardized test score themselves without any help from parents and any additional external support. So we recruited schools by sending an email to all Italian middle schools. And we also, toward the end of the period, received the support from the regional offices of the Ministry of Education that also shared our call for application from schools. Schools were allowed to select up to 3 students per class. And the criterion that they had to follow was to select the student that needed the most this intervention, this tutoring, because they had they needed support in their learning and they didn't have enough support in terms of like their family environment. Tutors were selected from 3 large Italian universities, and we simply sent out an email through the president directors of these 3 universities asking whether like tutors would be willing to volunteer to help children from a disadvantaged background. And if so, they had to complete a baseline questionnaire, same for schools and the students that were selected and families that were selected by the school to be part of this project. I have to say that I've been impressed by how generous the tutors have been. In very few hours, we got, from when we sent out the call to these 3 large universities, we actually got more than 1,500 volunteers that were willing to help. This was way above our expectation, and we were setting up a system to support these tutors that was not enough to cover all the 1,500 volunteers, and therefore like we are planning now to expand the intervention in September to make sure that we offer and we take advantage of all these beautiful availability from the volunteers in providing help to children from disadvantaged background. So the participants at the end in this project were 78 middle schools, and we got more than 1,000 applications from families from families that were selected by schools and by teachers. And at the end of the day, we were able to support 500 volunteers. So we were able to match 500 volunteers with 500 students. Here you see a map of Italy. So most of the schools were concentrated in the north. That was also the area that was mostly hardly hit by coronavirus. There are a lot of like differences across areas in the country, but this is like the geographic distribution, and still there will be random assignment of students to the treatment and control group across different areas. So the tutoring was done in different subjects. So it was mainly done in 3 subjects: English, Italian, and math. The great majority of students actually needed some support in math. So you can see that overall there were more than 75% of students that got support in math and math or like one of the other subjects. So this is like what was going on very early on. They started to be like newspaper articles from students that were extremely excited about this tutoring. And what I find very interesting, so this was like actually coming from one of these newspaper articles where there was this picture of the tutor that was based in Helsinki, and this is something like the student was particularly proud of in the newspaper article. So this actually inspired us because it could be that like this type of intervention could be implemented not only within one specific country, but it could be implemented more broadly internationally by exploiting positive interaction that could happen between tutors and students in other countries, especially in those countries where they can speak the same language. So we had a team of pedagogical experts. So this was like a huge component of the project for us. And it was something that we decided to do ethically to make sure that students and tutors were getting the right support in case something like happens during the tutor, during the different meetings between the tutor and the students. The tutors got actually exposed to a set of like a mini university course with like videos and slides on how to use technology during tutoring, the role of the tutor, and they had like some help in dealing with learning disorders because we had actually a pretty substantial share of students with difficulties and like learning disorders. They also got specific help in how to teach math, Italian, and English separately with like 3 separate modules. The tutor had like a forum that was supervised by a pedagogical expert to answer to specific questions they may have. And they also provided like group meetings with between like the tutor and the pedagogical experts that were actually helping the students, helping like the tutors to understand more better like their background, the background of the student and how to solve potential issues. Finally, we had like on call a one-to-one meeting between the expert and the tutor. So this is like the whole like support that they were faced with. So okay, let me skip this and go more on our data collection. So we have baseline information collected from parents, students, and the tutors. With like several information on the background of the students, and also we know a lot of details about the expertise of the different tutors and their background. Actually, I see there is one question in the chat. Sorry, Maya, I told you you could like go through that, but I think it's very good if I address it now. So schools were fully aware that this was a randomized controlled trial. So we told them when they applied that we had a limited number of tutors, and in order to be fair toward all the applicants, we would randomly assign them among like all the applicants. So this is something like both the tutors and the families were aware of. So what we did in order to increase the response rate in our data collection was to offer one gift card every 10 students of $100 in order to try to give an incentive also for control students to reply to our endline. And this is something, to be honest, that we find them very responsive to. So at the end line, we had to call a lot of like the students in the control group to make sure that they would complete the end line survey, and they were very responsive to the information of knowing about this gift card with like a pretty high probability of winning because it was 1 out of 100, and these tend to be families from a very low socioeconomic background, so they tend to be like very responsive to these incentives. Okay, so the randomization was done in blocks, especially because the first families to answer were actually those that were from parents that were slightly more educated compared to other parents. So not necessarily those that needed the intervention the most. So we did like different blocks of randomization, and we will take care of that in our estimation. And the students also, they could be selected for either a 3 hours or a 6-hour tutoring from their teachers. We had way more requests of 6-hour tutoring compared to the number of tutors that were available to offer this help for 6 hours. So we had a second level of randomization where among the students that requested 6 hours of tutoring, we randomly assigned them to these 6 hours or a 3 hours tutoring per week. And I will show you like some of the facts at this margin as well. Okay, so the outcomes will be divided in 4 main sections. So the first one will be academic outcomes with like a supervised test score with an enumerator that supervises that at end line. We have also beliefs about the number of correct questions the student would answer in this test score from the student themselves, their parents, and the teachers. We also collected information on grades from teachers directly and their beliefs. We have a second set of questions, including like aspiration, goals, and self-efficacy. We have measure of socio-emotional skills, including like perseverance and locus of control. And finally, a happiness scale and a children depression screener that will give us the impact also on those dimensions. So here you see the number of students that were actually randomly assigned to the treatment and control group were 1,059. The second balance table you see on the right includes 869 students that were those that either completed like at least either the student or the parent completed the end-line survey. So you will see that the number of observation will be for the end-line survey around 700 because we had some students that unfortunately completed only one part of the end-line survey, but overall, like we were able to reach at least 82% of students in the treatment and control group. And here I show you some balance table as like, so the original randomization worked perfectly and like all the characteristics well balanced. There are some slight imbalances in the end-line characteristics. So in the control group, they tend to be slightly more likely to have mothers from like at least high school or college. And this is something that we take into account, like by controlling for these characteristics. In the randomization, we are now thinking to reweight the results, considering this slight imbalance in a few of the characteristics that we have there. But overall, like we were positively surprised of like how high was the response rate, given that the end line was collected online and by phone interview. So actually online and like with like an additional request by phone, sending them the online survey again, but everybody was completing it online. Okay, so let me go straight on the characteristics of the tutors. So here you see a bunch of like baseline characteristics of tutor, and I already separate those that offered their availability for a 3 hours or a 6 hours tutoring. mainly because I don't want you to fully interpret the results on the difference between the student assigned to the 3 hours or the 6 hours tutoring as only being the time, because I believe there are like some additional differences in the type of tutor you get exposed to. And for example, you see that students studying economics, they were disproportionately more likely to offer the 3 hours tutoring compared to the 6 hours tutoring. Or students with a higher GPA were more likely to offer like a 3 hours tutoring. So somehow like there are a bunch of different characteristics between the tutors of students assigned to the 3 hours and the 6 hours training that we will need to take into account. Okay, so let me go straight to the identification. So given this slight imbalance, I will show you the results controlling for a bunch of like a fixed effect and baseline characteristics of students. Actually, they do not change much if we do add the characteristics or we don't add these characteristics, these controls. But like this is like given like these imbalances, we will always add these additional controls. Okay, let me go to the main result. So first, like a sort of like a sanity check. So we assigned them to a tutor that was mainly helping them to do homework during the last few months of the school year. So the first question is whether these students actually spend more time doing homework. And so overall, this is exactly what we find. So we find that both reported by students themselves in the first panel, from parents and from teachers, there is a higher reporting of the time that the students spend doing their homework. Overall, this doesn't seem to be a higher reporting of impact on the attendance on online classes that were actually done by the teacher themselves. But what our feeling from actually our information from the tutors is that a lot of their role was to keep the contact with the school and inform students on when the classes were held and how to connect and be able to actually attend the classroom. And indeed, in the control group, according to students, 83% of students are attending all classes. But if we ask the same question to the teacher for the control group is 57%. Because indeed, in a lot of cases, a student in the control group may have not known that there were some additional classes. And according to what is reported by teachers, there is an improvement of those that are assigned to the treatment also in their attendance to classes. So let me skip to the main set of results. So we have like 4 main outcomes. So the first one includes these academic outcomes. So the first column here, we have the impact on performance, which is defined as the number of the percentage of correct question in a standardized test score that is administered with the help of enumerators to these students, not in person, is online, but the students are doing it while on Zoom or like on Skype with the tutor, but with the enumerator, but the enumerator can see directly their screen of the students. And we do find that there is a 5 percentage point increase in the probability of answering having like a correct answer to these standardized test score done ad hoc. And this probability is actually corresponds to almost a 0.3 standard deviation increase compared to the mean of the control group. We also asked to parents, students, and teachers how many questions they would expect the student to get right in this survey, in this standardized test score. Actually, I find it very interesting that parents are way over optimistic in the control group. So they believe that students will do 70% of the question correct. Students are actually in the control group are closer to the actual mean. So they say that they will do around 65% of questions correct. While actually the number of correct questions for students in the control group was 53%. Teachers were a little bit below, but like way closer to that compared to parents. But what we find is that for all these groups, there seemed to be an increase in their beliefs in terms of like performance of the students, both for student, parents, and teachers themselves. So finally, we have other measures. So we have a measure of whether they like the different subject, and this we find again like a very strong impact. And also we have grades, a sort of like a self-assessment of the student, and also the grades coming from teachers. And in both these dimensions, we see like a pretty substantial increase from the students. So this is like taking an average, since like most of the tutoring was done both like in all subjects, math, Italian, and English. And this was like not randomly assigned, which some subject they were supposed to deal with during the tutoring. Here I'm showing you the results that are as an average for all these subjects. But we have the measure for like separate subject, and we find very consistent results for each of the subject. So this is like overall the first set of results. So in the second set of results, we have the impact on aspirations. And so here what we see substantially is a strong decrease in the probability that the students want to go to work as soon as possible. So in the European system, in particular the Italian system in this case, students after the end of middle school, that is when we implemented the treatment, they are tracked in different fields, in different like high school track choices. If they wanted to go to vocational school, it means that they want to go out and work as soon as possible. But in general, the earning path tend to be much lower if you do a vocational track compared to an academic track, or even like an intermediate track that is called technical track, that gives you skills to go to the labor market right after high school, but it also keeps like the opportunity of university open, while is not for those that attend the vocational track. So we do find like a decrease in their self-reported willingness to attend the vocational track, and a decrease in their aspirations, sort of like to go to work as soon as possible, instead of like finishing the high school diploma. So this is like the impact seems to me like mainly at the lower end, and not necessarily at the top end. So in pushing them like necessarily to go to the top academic track, or like thinking that they can actually attend university. And we see like a similar pattern for teachers when we ask the same question for teachers and parents, even if those are not generally statistically significant. Okay, so the third set of answers are aimed at capturing social-emotional skills, and in particular like persistence, through either like a grit scale from Angela Duckworth, or with like a logic, like a sort of like task to measure their persistency in doing like an exercise, a real effort task. We use like logic games, and we find that they tend to be slightly less likely to give up, but this is marginally statistically significant, and we don't find any impact on self-reported measure of grit. but we do find like a pretty substantial impact in terms of like a standard measure of locus of control. So they tend to be like more in charge of their future substantially. They want to have like more control over that. The last set of outcomes is related to a depression screener and like a happiness scale, and we do find a substantial impact in we do find impact in both dimensions, so a decrease in the depression and an increase in happiness. That is also reported by parents, even if only the happiness scale is statistically significant and not the depression scale. So what we do, like after showing like all these results one by one, we actually calculate indexes for each of these measures. So you can see here the performance, the aspiration, socio-emotional, and well-being indexes that will somehow like mitigate the potential issues related to multiple hypothesis testing. And when we add all of these together, in most of the, except for like the socio-emotional index that is borderline statistically significant, all the rest is significant. And here you see the 5% confidence bar. So we have an improvement in all these dimensions. Finally, in the last 5 minutes, I will give you some hint on what's actually going on, what's happening in terms of like a potential mechanism and behind the scenes in terms of like heterogeneous treatment effect. So the first aspect is related to the treatment intensity. So we know that 27% of tutors offer their availability for 6 hours per week instead of 3 hours per week among these 500 tutors. And we randomly assigned around 1/3 of the students that were in need for this additional help to these 6 hours of tutoring instead of 3 hours of tutoring. And so what we find is, first, again, like a sort of like a sanity check. If they're assigned to the 6 hours of tutoring, they are actually working more, they are doing more homework, both according to what is reported by the child and what is reported by the teacher. But what we find overall that in terms of like the performance, there tend to be like a pretty linear impact. So having a 3 hours tutoring on average leads to a 4 percentage point increase in their standardized test score, and it almost double for those that are having a 6 hours tutoring. Again, with the caveat that I said at the beginning, that this is like a combination of the different type of tutor that you may get and the intensity of the treatment that you have. But like in all the other dimensions, so in the other 3 indexes, the aspiration, socio-emotional, and well-being indexes, we don't see like heterogeneous effects between like those that got 3 hours and 6 hours of tutoring. And this could be because already having someone outside from your family during the period of lockdown that is providing this support is having already an impact on your socio-emotional and well-being aspect, and we don't find any like differential effect on aspiration, even if here you see the impact tend to be bigger, but like not statistically significant. Okay, so finally, in terms of like heterogeneous treatment effect, we have a lot of characteristics of these tutors and these students. Something that is key for us, and we had like clearly in mind at the beginning, was the issue related to access of technology. The Minister of Education in Italy like set a lot of like money during the COVID crisis in order to give like to rent sort of like a tablet to all children that didn't have any tool at home to be able like to follow the classes. So the great majority actually of students and that were part of our treatment had like at least a tablet or a computer at home. But like this doesn't mean that they need to have like a good internet connection with that. So this was still an issue, and we have around 20% of our sample of students that didn't get any, that they used like the phone to do the tutoring. And so we'll show you whether there are differential effects if you use the phone for the tutoring or if you didn't. And I will show you some preliminary evidence in terms of like heterogeneity in terms of like student and tutor characteristics, but we are actually working on providing like evidence using like a causal forest algorithm instead of like showing the traditional heterogeneous treatment effect, given that we have a lot of like dimension at baseline. So in terms of like the use of the device, whether like for these 20% of students that actually use the treatment using the phone instead of any other devices, we actually do not find any statistically significant impact in any of the dimension. So this is, again, of course, they were not randomly assigned to do the tutoring using the phone or not using the phone, but I think this is like sort of reassuring when we are thinking about potential scale up of this intervention. And finally, here we have a bunch of like heterogeneous treatment effect in terms of like characteristics of the student. And we don't find much, to be honest, except for like a student from learning that had some form of learning disorders. These are around 1/3 of our sample. And this is like a population we were particularly worried about because we thought that our tutors didn't have the training and the skills that was necessary to support these students. Well, here we do find that there is like, if anything, like a more positive impact on this dimension. And again, if anything, the impact is stronger for those that have low educated parents, but the standard errors are huge because we have a few highly educated students with highly educated parents in our sample. And this is a little bit the absence of this heterogeneous effect is there with considering all four main outcomes that we have in this paper. There seems to be something like interesting going on in terms of like well-being and depression of immigrants that tend to be pretty high in the control group, and we see like a pretty strong effect for immigrants in this dimension, but we need to be careful because here we tested like a lot of like different assumptions. One aspect I was particularly interested in was the match between the tutors and the students, and we do the gender match. So whether if you are assigned to a tutor that is of your own gender, whether you have a stronger impact, and we don't find much also in this dimension. So let me close here so we may have time for questions if you have any question. But so what I show you is that we implemented this online tutoring in the middle of the emergency, and we provided like a form to have like a cost-effective intervention that was actually helpful for disadvantaged children in order to catch up and not lag behind more in terms of like both academic outcomes, but also in a wider range of outcomes, including like aspiration and well-being, and somehow like on social emotional skills, even if the results are strong only on the locus of controls. So we are currently, we received the funding to scale up this intervention, and we are about to start the new round by recruiting like both from the old group of tutors and like new tutors that could be willing to help. And we are also planning to change a little bit the assignment. So instead of like using like just random assignment, we will try to see whether there is a better way of targeting children by having like in one treatment group in some classes, the random assignment, in other classes, the ability to target precisely students according to what teachers consider the student that would benefit the most from the intervention. Finally, on the last treatment arm will be using like machine learning to somehow predict, given the baseline characteristics and what we have from our sort of like a pilot, those students that will benefit the most from the intervention. However, like we are still, the project didn't start yet, so any suggestion is welcome, either now, if you wanted to ask any question now, or whether like if you wanted to write me later, I would be very happy to get any follow-up question or recommendation. Let me just close thanking like the team, because I think they have been like overall like amazing team of like pedagogical experts that were helping us in a very short run, and an amazing team of like management and array and the array work that were able like to provide help and like communicate with these tutors to make like the intervention run smoothly. Thank you so much. And let me see.
Thank you so much, Michela. We do have one question, and I'm going to encourage everybody else to jump in the Q&A box, or you can also raise your hand and we'll have you ask the question live. So the question that we did get was, did the tutors get any incentives for volunteering? And do you think that added incentives to tutors will impact the outcomes?
Yeah, so to be honest, we didn't give them any incentive. And when we started the project, it was really like a little bit in a rush, and we didn't provide incentives. Toward the end of the tutoring, we realized that we could at least provide a certificate to tutors that volunteer for this project. And so at the end, we gave them like a certificate to thank them for their work. And I was impressed on how many of them like posted it on LinkedIn, and now they are adding them in their CV. And so we are thinking that in the new round, this will be something that we implement and we advertise at the beginning instead of like doing it only ex post. We are also talking with some ed schools in order to try to put this in a more structured way within their program, because they are training a bunch of future teachers that may be very willing to be part of this intervention, to learn more from themselves, but also to get university credit, or to write a thesis on their relationship with the students and how it evolves during the training, the tutoring. And so this is like something that will be part of the follow-up and scale-up. And I think this is like extremely promising, seeing it more broadly on what we can do in the future and how we could like scale up this sort of intervention in other contexts in order to get qualified tutors that are willing to volunteer and still keeping like the cost low in a way that it can be provided to a large group of disadvantaged children. We actually got in touch with several organizations that asked us to implement a version of our tutoring program in different countries. So I know that in Chile, they are working on a version of that. They are working in Argentina, Peru. So we got a lot of like contact. And so I think like this was like strongly part of our recommendation, how they selected the tutors and how to encourage them to apply more broadly by giving like them some incentive without taking out completely like their intrinsic motivation. So this is something very important. I think there should be like a very high level to their intrinsic motivation to have this effect. But on the other hand, they could like get some advantage from providing some mild incentive or at least acknowledgement of like the work they did.
Wonderful. I think that ties into another question that we just received that states, in the new round, can you choose countries in development to see the outcomes?
Yeah, so this is like a great question. And to be honest, we have been thinking for a while to be actively part of like some of the other interventions in other countries. But it was very tough, like with the time and being able like to implement a very be like ourselves highly involved in this. So we gave them like all the direction to implement a version as close as possible to what we implemented in their scale up plan, but they are doing it in an independent way. And substantially, a lot of these organizations that reach out to us, they wanted to start in like 1 or 2 weeks, and we need to go through IRB and like a lot of like processes that we didn't have time to at that moment, because they were already starting to recruit the tutors, and so we were a little bit in a rush situation. But I think that and so in Italy it was easy because we had just like the same IRB application with like the follow-up. But I think this is something that if like there are researchers that are willing to scale a version of this and like improving this as much as possible, I think is a great field where there could be collaboration.
Wonderful. Another question we received was, do you think a change or rotation of tutors might have a significant effect on the various outcomes, especially in socio-emotional skills?
Yeah, so I think something very important was to have a stable relationship, and this is something like the pedagogical team stressed a lot, that they needed to build the relationship between the student and the tutor. And so having like someone that rotate, or like someone for like too short a time, I'm not sure this would lead to the same effect. So I think having like a really like building up the relationship is very important. And we had tutors that helped the student like way longer compared to what they were supposed to. So they were supposed to finish like in May, but like we know, like we had some tutors that send us a picture that now they met in person with the student they were assigned to, because now they were allowed to travel, and so they traveled to meet. And so I think like building up this relationship is very important for an effective tutoring. Yeah, for an effective.
Definitely. Thank you. One more question. What key advantages would you say Italy has that allow this to be successful operationally? I'm surprised at how access to internet or devices wasn't too much of a concern to make it successful.
Yeah, I mean, 20% of students that only use their phone, they mainly use the phone because they didn't have a decent connection, but like everybody in Italy has a phone. And so this is definitely an aspect that may have been helpful for making this intervention useful. So the issue could be like in developing countries, and this was also part of like our concern that if you don't have an internet connection at all, even with the phone, then it could get like very tough to build this connection. And so this could be particularly difficult in slums area. Even if like I know, I'm working for a different project in Brazil with like disadvantaged children, and almost all of them tend to use WhatsApp, for example. So tend to be like a very common way for like even disadvantaged children to communicate. And so this is like, and like when I was talking about using the phone, they were substantially using WhatsApp to communicate. And sometimes they were even like using like the WhatsApp for the video call, but sometimes it was even more like interactive doing the homework, sending like the exercise to the tutor, like their solution, and the tutor like answering back with their comments. So they were like very creative in actually finding out ways to get around the potential challenges that were there with like technology issues.
That's wonderful. I think we're at time. So I just wanted to thank you so much, Michela. We really appreciated your time with us today, and thank you to all of our attendees, and we'll see you next time. Thank you.
Thank you so much for the invitation.
Of course, thank you.
Bye.
Bye-bye.